The main difference between cancer and other disabilities is when cancer survivors come back to work, they actually can seem to be completely cured physically. They seem to be fully recovered, but the symptoms like depression, fatigue, pain, all these things are not directly visible. So that's the first thing. It's very difficult for the colleagues, for example, to understand that they still need some time and they are slower than before and so on. The other thing, it's also about the late effects. So some effects of the cancer treatment can appear some months after the end of the treatment, and even if the patients are not in relapse, so they do not relapse, they actually can feel very bad because of the late effects. The most effective measures are those who both integrate economic incentives for employers, for example, but also focus on rehabilitation. So both measures need to be implemented together to be effective. For example, in Denmark, where they started quite a few years ago, I think they're really the pioneer of this return to work measure and work. And there in Denmark, they have established a kind of charter for employers with really practical tricks for the employers, but also for the employee, and how they could work together. So they have kind of guidelines that can be used by employer and employee to cope with all the problem they could face. We recommend to integrate medical follow-up and social follow-up. It really has to go hand in hand as long as possible for the employee. We also try to raise attention on the fact that health professionals have to coordinate with social workers to support the employee and the survivors. And then the third thing would be really the change in the mentality. People have to really think what productivity means to adapt to the reality. And I think probably in the future, no, people will not be longer 100% productive as we intend. So we need to really think about maybe being more open to what is productivity.